So I'm Erin Berical. I'm so excited to be here today because we so rarely get asked for the data that we collect and analyze. And we just usually write reports and sort of put them out into the ether and hope that they are read. But getting a request for us to actually talk about the work that we've done doesn't always happen. So I'm very excited to be here and talk about the data that we have been collecting over the last few years as part of the New York State B5 project. As I said, I'm Erin Berical. I'm Assistant Director at the Center for Human Services Research at the University at Albany. I made a note to introduce myself because sometimes I forget. So again, very excited to be here. We are going to be talking today about the needs assessment data that we have been collecting here at CHSR as a part of the New York State B5 project. And specifically, I'm going to be talking about data to support the development of the ECAC strategic plan. So I know probably most of you that are here are a part of the ECAC and getting ready for the big meeting later on this week, which I'm hoping to be at least part of that. And so I really wanted to target in, we have obviously gotten and analyzed a lot of data, but I tried to pull out the elements that I felt were most relevant to the strategic plan draft goals that were provided to me that you all have been working on. So I realize those goals are not final yet, but I did use them as sort of a guide with the data that I'm going to be talking about. Okay, so just a little bit about who we are for those of you that aren't familiar. We are the Center for Human Services Research. We have about 30 years of experience, a little over 30 years of experience in doing primarily program evaluation and research evaluation activities. We work on lots of different projects, both across the state and nationally, as well as locally. We have about 30 researchers here that do a variety of different types of research, both qualitative, focus groups and interviews, as well as quantitative, so survey collection, secondary data analysis, all that fun stuff. We work in fields like mental health and substance abuse, child abuse prevention. We have a small IT shop. I'm going to talk about them in a minute because they developed a very exciting web application as part of the New York State B5 project, and criminal justice and lots of other areas. I've been involved with the New York State B5 project since the beginning. We did our first comprehensive needs assessment in 2019. I'm going to talk a little bit generally about the results from that in a minute, and then we've been able to update the needs assessment every year since then. So this is my baby, and I'm very excited to talk about it. So just in terms of the major activities that CHSR has been involved with the New York State B5 project, as I mentioned, we have done a number of needs assessments and updates since the beginning of the project. I have a link here that by the end you will have in your chat box, and that will link you to all the different. Mostly, I would draw your attention to the executive summaries. We got a little happy with some of our report writing, so some of them are fairly large and comprehensive, but the executive summaries will certainly give you kind of the nuts and bolts of what we found for each of the needs assessments that we did. We did updates in 2020, 2021, 2022 is not quite finalized yet. It should be out soon. And we are currently in the process of collecting data for the 2023 needs assessment. And that will hopefully at least be out in draft form by the end of June and probably finalized hopefully by mid to late summer. I just want to highlight a couple things. One is that when we talk about sort of a comprehensive statewide needs assessment, our focus was really not on the entire early childhood system. So that's obviously very vast and comprehensive. We had to focus in a little bit. So our focus really was on childcare settings, early intervention, special education preschool, universal pre-K. So we really focused in on those settings and programs that are the goal of which is to provide care and education. We didn't really focus too much on sort of the medical side of things, the dental health, all of which are very important, obviously, to young children, health and development, but we just did not have the time or resources to tackle that. So you'll see the results and the activities that we completed are more focused on those childcare settings and educational settings for young children. The data that I'll be presenting today stops short of including a reflection or an evaluation of the majority of funds that have been infused into the system over the last couple of years. The data that we're collecting now has a bit of that in it. And I'm hoping, if we get more funding and can continue this work by next year, we really will be able to talk to providers and to parents and get an idea of how that money is really, we have some initial results from that, but not really a comprehensive understanding of what that money has meant. We know it's meaning good things. I'm sure you all know that it means good things, but just so we're all sort of on the same page that we're not really tapping into that yet because it's just a little early to know sort of what the outcomes have been. We have also been involved in the early childhood integrated data system feasibility. So we did a couple of reports early on in this project to talk about sort of the current state of data integration and have been involved with the Goal 9 or the data assessment or data work group that's now chaired by Lori Black and Bob Frawley. We've been very excited and interested in that work. So we've been a part of that for a while, 2 years. We developed, I didn't, but our Cracker Jack, very brilliant IT department developed a pyramid integrated data system that has now been rolled out across the state, and we hear good things about it. So I hope it's working out for everyone. And also we've been involved in the program performance evaluation plan, which is really looking at the process and outcomes for the different funded projects as a part of the New York State B5 grant. So we've been involved in lots of different components of this work. All right, so let's talk a little bit about the different activities that we have done as part of this needs assessment over the last several years. There's 4 major ways that we have collected data. So we've done some key informant interviews, focus groups, we've done a variety of surveys, and we've also conducted environmental scans and some secondary data analysis, especially looking at census data for that initial needs assessment that we did in 2019. That initial needs assessment done in 2019 included key informant interviews with 17 people from OCFS, DOH, SED, the ECAC, the OMH, and OTDA. So we were asking them sort of about their different roles within the early childhood system, got some really great feedback. We did a survey. I'll talk a little bit about the demographics and responses in a moment, with parents, direct support professionals, as well as program administrators, so daycare owners, different administrators of different types of early childhood programs. We also conducted focus groups statewide. So we had at least one focus group in each economic development region within the state. Many regions had more than one. We conducted focus groups with parents, direct support professionals, as well as administrators. We looked at census data, and we did an environmental scan of over 75 available reports and other types of documents for that initial report. In 2020, of course, we had grand plans, and then there was a worldwide epidemic that happened, which put a little monkey wrench in what we were planning to do. But we were able still to do some key informant interviews. We thought it was really important, without trying to disturb the system too much, to better understand the way that COVID was impacting both families and the early childhood care and education system. So we were able to talk to key informants, including CCR&R directors, home visiting programs such as Healthy Families, Nurse-Family Partnership, and Parent-to-Parent. We talked to community health worker programs, school district personnel, Head Start personnel, migrant and seasonal Head Start. And we also did a parent survey to try to get a finger on the pulse of what parents were going through. And we got a lot of very important feedback, especially about the vulnerable populations that in New York State and the significant toll that the pandemic took on those vulnerable populations. I'll talk a little bit more about that in a minute. And finally, in 2021, we did another parent survey as well as parent focus groups. So we've been busy and we've been talking to a lot of people, and I'm hoping, again, to bring that data that we've collected both from individuals face-to-face, over the internet, over Zoom, and over surveys to you today, and certainly willing to have follow-up conversations if any of you are interested in a deeper dive into any of this data or the results that we found. So this was the very first needs assessment. It was published in, I think it was early 2020. It included a lot of prescriptive elements that the federal government wanted us to cover. So things like defining key terms, creating or trying to the best of our ability, create and count the unduplicated number of children being served, the quality and availability of the ECCE programs and services, how in New York State we maximize parent knowledge and choice, the quality and availability of programs, as well as these additional elements that are listed on the slide. One of the more interesting and important things that we were able to do is really come up with a description of vulnerable and underserved children in New York State. So we were able to develop a pretty lengthy but very inclusive definition of who do we consider vulnerable children. And as a result of this report, that includes young children of minority ethnic groups, young children living in low-income households, young children experiencing homelessness as defined by McKinney-Vento, young children receiving EI or preschool special education services, young children living in multi-language households, young immigrant, migrant, or refugee children. And specifically to this grant, they wanted us to include young children living in rural areas. So that was a big focus for this first year of the needs assessment. We're getting into those rural areas and talking to parents and professionals that work in those regions to see what those needs are, since we rarely get out to those groups to talk to them. For demographics, you'll see that the first year that we did the needs assessment, the parent survey and the direct care staff survey, we were able to get 667 parent survey responses. A majority of those were female and white. We were able to get some African American and Hispanic input, but you'll see as we go along, that number goes down a little bit during COVID, but then up significantly in the 2021. So that was good news. Direct care staff, we had 731 responses, again, a majority female and white. The administrator survey that we did that first year had 818 responses. Again, majority female, majority white. The needs assessment groups sort of followed the same path. We had 83 participants in parent focus groups, 87% female. Over half were white. We had a fairly decent response, especially from primarily Spanish-speaking families to that focus group. So that was good. Direct care staff focus groups, 75 participants, mostly female, mostly white. The administrator focus groups, same, mostly female, mostly white. We had 77 participants for that first group. All right, let's talk just briefly about the findings from this initial needs assessment that we did. So we categorized them into 4 categories for the purposes of this presentation. The first one was system building. So what we found was that the state's early childhood infrastructure and investment in ECCE programs and services reflect a strong commitment to supporting young children and families. But given the current state of the system with multiple oversight agencies, corresponding differences in the governing laws, regulations, policies, et cetera, translate into inequitable accessibility and quality of ECC opportunities, especially for the state's most vulnerable and inefficiencies in the provision of services. There have been groundbreaking cross-sector collaborations, such as the first 1,000 days on Medicaid and the Board of Regents Blue Ribbon Committee, but more coordination is needed among these collaborators and collaborations. Programs are blending and braiding funds to better support the early childhood system, but they often are limited in their reach. And while transition processes are supportive for many children, they don't reach all New York State children and families. And that will be something that will come out in our most current needs assessment that we're still working on as we talk a little bit about that transition between early childhood and kindergarten. While New York State has a variety of unique program settings, many share common facility concerns, such as those related to locating affordable and safe spaces and upkeeping buildings. In terms of the data and workforce development, we'll talk a fair amount about this in a moment. But existing professional development tracking systems for the early childhood profession are often siloed and underutilized. Significant strides to professionalizing the ECCE workforce have been made. However, compensation significantly lags behind, and it leads to people leaving the field at pretty large rates. In terms of access to quality programs, New York State does not have the necessary data to comprehensively analyze the early childhood care and education system needs. The state, from what we can tell, certainly from the data that we do have, the state does not have a sufficient supply of ECCE programs and support services, especially in rural areas and statewide for infants and toddlers. New York State does not currently have a universally accepted definition of quality that's applied to all ECCE settings. And while many parent-friendly resources exist, the majority of families who participated in that initial needs assessment reported not being aware of them. So this is probably not like major news to anyone. I think most of us understand and recognize that for years these things have been needs, but now supported by actual data that we have gathered from the system. And let's see, quality ECC programs remain inaccessible, especially for low-income families. And finally, more special education and early intervention providers are needed throughout the state, and additional efforts are needed to ensure that children in special education receive the services in their least restrictive environment. I'm going to sort of especially underscore this point later on as a theme that came up every single year, the lack of special education supports and early intervention evaluations and services, because that is something that is just really upsetting and frustrating to families. We've heard it over and over again. So definitely needs to be sort of underscored. Okay, so I said a minute ago that there is no universally accepted definition of quality. So we asked parents in that initial needs assessment, what do you think are the top 5 ingredients of a high quality program? And this is what they said, which isn't probably too far off from what we all might consider part of a high quality program. So staff who have experience with children are warm and responsive, are sensitive to parent and child's needs, and frequently communicate. So that seems pretty in line with what we all might consider high quality. And that the program has hours that accommodate working parents, including extended and weekend hours, is reliable. So, when we talk about the pandemic, how many programs had to shut down or go fully remote, really hurt families, especially families working in jobs that never went fully remote and still needed that childcare element. Programs that have well-maintained environments, that offer healthy food options, have structured routines, provide opportunities for learning through play, offer a developmentally planned strengths-based curricula, and has a high teacher-to-child ratio. So again, that is some feedback that we got directly from parents about what they think high-quality program means. Okay, So let's talk a little bit about the demographics before we get into the specific data points of the needs assessment updates that we were able to complete. So during that 2020 year, I mentioned that we were pretty limited in our data collection because there was a pandemic going around, and we didn't think maybe talking on the phone to us or filling out a really long survey might be at the top of people's to-do list. But we still were able to get 651 responses to the parent survey that we did send out. 85% female, 74% white. We dipped a little bit in our ability to reach African-American families, parents during that year. We were able to bump up the number of Hispanic families that we were able to include to 21%. But after this needs assessment, we really knew that in subsequent needs assessments, we really, really wanted to bump up and to reach those vulnerable populations, including racial and ethnic minorities. So we actually convened a meeting, and some of you might have been there, and we asked, professionals that work with vulnerable families, how do you engage them? Like, what are the best practices for getting people to talk? And so we were able to kind of weave in together some additional strategies, including using trusted messengers. So we were able to connect with some trusted messengers down in New York City that worked with a number of families who were recent immigrants to this country. And he was able to bring in a group for us. We were able to reach out to other group leaders, whether it was through the Office of Berical or through some of the email and social media outreach that we did. So we were able to bump up the numbers of both African American as well as Hispanic respondents in the 2021 parent survey. And the other thing that I wanted to highlight that I don't think is in the slide deck that I sent you, I just put this in because we were able to reach through this trusted messenger a group of parents who were primarily Mandarin speaking. We were able to get their feedback on what the system is like, both for non-English speakers, which we were also able to collect through our Spanish language focus groups, but also being new immigrants and having children with special needs and what it's like to try to navigate that system. So that was really important information that we were able to gather and include in our report. The parent focus groups for the 2021 year included 212 participants. These focus groups were conducted completely on Zoom, but we were able to get a pretty diverse group of people. So again, that was good to be able to see. Okay. So let's talk a little bit about the analysis that we did and some of the data themes and the data that we were able to find through these needs assessment and how they link to the different goals that, again, I know are in draft form and not finalized yet. But as you go into the retreat later this week, I'm hoping they might be of some use to all of you. Okay, so the first goal that I saw was closing the racial equity gap in early childhood care, health, and education. And it was a little hard to pick out specific data points that supported this goal, because I think basically all the data points supported this goal. And really the message here was all of the families and providers that we spoke with, both before the pandemic, during the pandemic, and since the pandemic, really reported that everything bad that happens in the system is worse for Black and Brown families and leads to more disruption in their lives compared with others. One of the sort of silver lining points that we were able to hone in on was that having the help or connection with a leader or a group within the community and being able to connect with others was really, really important. And this was especially true during the pandemic. Families and families that had access to very small community-based providers that had leaders that were a member of their racial or ethnic group had a much easier time connecting with things like food needs and diaper needs, and even connecting to other financial resources or other ways to get help and get assistance during that time. So that was a really key finding. But really, the overall message is that this is it's a huge issue. Equity is a huge issue within the early childhood care and education system. I know that you all know that. So having a goal that's related to that, I think, is obviously critical, and the data reflects how critical of a point that is to really focus in on. So for goal 2, ensuring families and communities have the knowledge, skills, supports, and resources needed to create healthy and nurturing environments inside and outside the home for young children to thrive. Some of the questions that we really asked families mostly about challenges. So in a minute, I'm going to talk about some bright spots and some areas where families and providers are very positive. But since it was a needs assessment, our focus really, again, was on where those gaps and challenges were for families. And so most of them responded that the top 5 challenges are really the cost of care. Almost 3/4 of the respondents felt like that was a huge issue. There was no one we talked to or heard from that was like, yeah, cost of care is really easy for us. It doesn't impact our life at all. That everyone said that it had some impact on them. The number of programs and services that are available, nearly half of respondents said that was a big challenge. The length of wait lists, the availability of care at non-traditional hours, and the quality of care or services to a lesser degree was also a huge challenge for families. In terms of availability, access, and affordability, so the top 3 reasons that family reported that their childcare needs are not being met. Obviously, the number 1 was that childcare is too expensive, there's not enough providers, and there are no available spots. 70% of the people that responded stated that the lack of childcare has affected their job. So that's pretty stark and astounding. And you probably don't have to go too far to talk to a parent who can either tell you a story or is currently facing a situation where their childcare issue is affecting their job in some way. 68% of survey respondents said they pay out of pocket for childcare. And of these, 70% report that childcare expenses put some or a large strain on their budget. And then half of the caregivers reported receiving assistance. And so how are parents receiving information? Now, again, keep in mind that this particular data point came out of one of our earlier needs assessments. And I think there has been, both through the New York State B5 grant as well as through other channels, additional campaigns and information that has been accessible and specifically targeting parents more generally. But the question was really about how parents receive information about available programs and services. And while we would hope that they were accessing trusted sources, such as the OCFS website, the parent portal, other places like that, really where they're getting their information is through family, friends, and social media. I just remind everyone to please mute your mic if you are not trying to interrupt. So the takeaway for this is really that the methods for disseminating information need to include lots of different methods. So using social media, but using it through trusted community representatives. So again, those trusted messengers and advocates, and sharing things not just on Facebook, but on other social media platforms, WeChat, WhatsApp, that way. billboards. I know, again, that the media campaign that happened over the last couple of years of the NYSB5 grant was advertising on billboards. They set up a parent portal. So that all, I'm sure, helped to get out the information. Again, we haven't necessarily heard through the data collection methods that we've been doing that it's moved the needle much on how families are accessing services or finding out about services or programs, but it could be just a lag in time as well. And the final point is that paper resources and flyers should really be posted all over the place. So in apartment buildings, libraries, grocery stores, and childcare centers. So thinking about places where parents go that aren't necessarily connected with a program or service, that's probably a good place to target some of the different resources that we want to get into the hands of families with young children. So I thought this was a really nice, it was a really interesting and powerful quote. And what it really, to me, underscores is how many families live on the brink. So, she's talking about how if you make $1 more, then the system won't help you. And for many families, we heard this, that, if they got a different job, then they would lose their subsidy, or if they went back to work full time, they wouldn't qualify for aid. So it's a real balance that families walk. And we heard this from providers as well, that, as much as they try to work with families and work with the counties, that it's a really difficult dance that, especially during COVID, was, pushed one way or pushed the other. And just the point that everything is going up in prices for everybody. So she mentioned they should change that. I don't know if she knew who the they was, but it's something to consider, again, as you move forward with this strategic plan.
Yes.
And so we'll talk a little bit about the data that we've been able to collect about the workforce, with strategic plan goal 3 being to foster a skilled, sustainable, and professionally compensated early childhood workforce. And again, this is not taking into consideration much of the money that has been, once again, infused into the system over the last year or so. This was all data that was collected prior to that. And we don't have, at this point, we don't have any outcome data related to that money that has been infused. But prior to that, 38% of direct care staff that were surveyed for the initial needs assessment reported that they make less than $25,000 per year. 1 in 5 staff reported that their current salary meets their needs. So that's a pretty low number. Many work multiple jobs to make ends meet. And over half of people that responded reported that salary is a primary factor in leaving the ECCE workforce. So you'll see on this next slide that it really becomes frustrating, not just for the workforce, those direct care staff, but also for program owners and for larger providers. We heard reports during focus groups of this sense of competition between childcare programs, both home-based and center-based, and school-based programs, with the home-based and center-based providers being really frustrated that they hire these staff that are either minimally and even not quite certified or qualified to work in their programs, and they invest money in them to train them and get them up and get them credentials and ongoing professional development. And then the staff will almost immediately leave for higher paying jobs in the school district. So we know that staff turnover leads to lower quality programs. Certainly the parents in the focus groups expressed concern about the turnover in their child's program, and that it disrupts routines and the continuity of care for their child. And, providers and administrators are obviously and understandably frustrated and concerned about the cost and how time consuming it is to continuously be hiring and training new staff. So that is definitely something to keep in mind. But let's talk for a moment about some bright spots, because there are definitely a few. One, and this is again some early data that we were able to collect about some of the COVID money that came into the system, so those stabilization grants. And we're in this needs assessment that we're currently finalizing from last year, able to talk to a number of home-based providers that felt so thankful just for the money, the grant money that they were able to receive. And they really wanted to express how helpful it was in getting them through the pandemic. And a few of them talked about how, their business model is so precarious and there's just so little wiggle room that they really, for the first time, felt like they had some breathing space. Not that they were like going on vacation to Bermuda or anything, but they felt like they had a little more financial stability than they had in the past. And it really, again, that you could feel that sense of relief and support from OCFS and from the government, that they were recognizing that this money was needed and making it available to those that really did need it. The other thing I wanted to sort of highlight, which I did not put a quote on the slide, but we definitely have heard consistently, is how much families love universal pre-kindergarten programs. We didn't get the same vibe from the childcare providers that work in those communities who are losing children. But for families, it was such a relief to them to have a high quality program for their child to go to, even for at least part of the day, that they didn't have to pay for. Really, again, got this sense of relief from families, a little bit of breathing room, which, kind of got squelched a little bit during COVID, but the idea that they were living in an area where they had access to either pre-K3 or pre-K4 programs that were provided at no cost was a huge benefit to them, both financially, and they felt that their children were getting a really good experience and getting used to being at school, so that transition to kindergarten was much, much easier. And then just thinking about the goal 5, strengthening the ECAC system to drive change, lead, inform, and build a strong early childhood system. I wanted to sort of piggyback on, I was actually at the last ECAC meeting where there was a discussion about how to include parents and providers, or wanting at least to include parents and providers, especially parents and providers from diverse backgrounds, to having input into the system. And it sort of made me smile a little bit, because as we were doing focus groups, and even sometimes on the survey, both parents and providers would thank us for asking them these questions. And here we think as data collectors that we're being so intrusive and that we're putting people out, but there was really a sense that they were so happy to be asked for their input and really wanted to have that input, and felt often that no one was ever asking them the question or listening to what they said. So I think both parents and providers do want to have high level input into the system that is really affecting them. And, together that group has the greatest impact on outcomes for young children. The other thing I want to, again, underscore is that the parents of young children with special needs especially feel like they have a lot to say, and they feel pretty desperate about the state of things. So I'm going to talk a little bit more about that in a minute, but again, an important thing to keep in mind. So of course, my favorite, the one that I'm going to glom onto, is the one about data. But this strategic plan goal that data is needed for system improvement, policy development, funding, and best practices across New York State. I think this one is so key. We've talked about sort of the lack of data, or the data gaps or holes for many, many years, like beyond just when the New York State V5 grant started. But I do think it really is critical and key to use data to drive priorities, and not just available data, but making it a priority to fill in those data gaps, because it's impossible to really know what's needed if you don't have the data to support it. And I was very much encouraged when I was at the most recent data work group meeting this past week, that as we hear the state agencies talk about upgrading their systems and developing new systems and updating and whatever, that they really have a focus on ways that data can be integrated. So I think we're really moving into a time where people appreciate the purpose, the need, and the usefulness of data. And that really is a huge barrier to overcome. So when you get people on board with the idea that data is really important and useful, it makes a lot of the other components of building an integrated data system much, much easier. So good job, everybody. Can't wait to see what happens. And so just to talk about a couple pieces of data that really were pervasive throughout the needs assessment work that we've been doing. And really the big one is the young children with special needs. We've just talked to so many families who, hear from their doctors how important it is for their children to be diagnosed early and start to get therapies early, and then aren't able to get those services. Families that cross state borders to get them. And it is a huge gap that is partially, I'm sure, due to funding and partially due to many other reasons that are very complex. But it's just very frustrating. We've talked to families who, like I said, have crossed state lines, have driven, hundreds of miles, that are finally able to get some services because their child was able to get into a universal pre-kindergarten program. So they're able to get their services, at least from school district personnel. And so there are, I think, some good things coming out of the need, but pretty much everyone we spoke to said there just aren't nearly enough, either people to do the diagnosing or therapists to provide the services that are needed. So just a couple quotes on this slide about that kind of highlight and underscore that need. And then the other thing is, I think just understanding which, might or might not be happening at the ECAC level, that different provider types have different needs and challenges. So, we spoke to home-based providers who, as I mentioned before, and I'm sure that you all know this, have such a thin line between being financially solvent and needing to close. We obviously, during the pandemic, talked to a number of providers who did have to close, mostly actually center-based programs. A lot of the home-based providers were able to stay open because they were able to be flexible. So just different, not everyone obviously fits the same box. And it's important when you think about goals to also keep in mind that one goal isn't going to fit every type of provider, or one type of support isn't going to fit every single program. So that was something that we heard a lot when we were talking to, mostly during focus groups, when we were talking to the different types of providers. So recommendations that came out of and as a result of this work, the first one clearly being from COVID times, that more online platforms to access healthcare and medical professionals are needed. Obviously, more childcare centers, more wraparound and respite care for children with developmental disabilities and other challenges, more funding for early intervention, more transparent communication, more staff receiving training on equity and inclusion. And I should also mention, actually going back to the previous slide, we didn't just hear from parents that it's been difficult to access support services. We also heard from, especially from home-based providers, that they have sometimes a hard time accessing training or understanding or having the skills they need to support the children that are in their programs who have some type of special need, whether it's a physical need or some other developmental need. And they felt like that would be very helpful to have, more training available to be able to better support children with a variety of different types of needs. More community-based supports and more equitable access to free services and high-quality childcare. So I want to kind of end with this quote because I think this parent really summed it up very well. So she says, in the state of New York, the way that services are provided aren't equal, that it depends on where you live. There are districts that don't have full-day kindergarten. It was a fight for me to get my son into full-day kindergarten. We had to enter a lottery, and thank God we got a spot. There are districts that have universal pre-kindergarten programs for 4-year-olds if you live there. In New York City, there's 3K. Some have Head Start from 3 years on, full day, and it's free. To me, this is not fair. All children in New York State should be equal. I know that there are some that don't want to send their children full day, but I think this would help with the cost of education, with the future, and with equity. So we should probably try to figure out who that mom is and bring her on to the ECAC as a parent member, because she clearly knows, has a lot of thoughts and feelings, and kind of really has some good thoughts to share. So that was all of the data that I had wanted to present. I'm going to let you write down my email address if you would like to, or it's actually also in the slide deck. Then I'm going to stop sharing so I can see everyone, since I've been staring at my camera for the last 40 minutes. There you all are. That's nice. Okay. So who has questions, thoughts, want clarification? I don't know how much clarification I'm going to be able to provide on the spot, but I'm more than happy to look into the data for you if there was something that was particularly interesting or thought-provoking for you, and send it to you over email or bring stuff with me to the retreat on Wednesday. I just overwhelmed everyone, and now no one's going to go to the retreat. Lock the doors when I show up in my car. I get it. Happens to me a lot.
And people can also put questions in the chat if they'd prefer.
Sure.
And Erin can now actually see them herself because she's no longer presenting.
I can.
So if you prefer that mechanism, it's also open.
Okay, well, clearly I did the world's best job presenting that data, so no one has questions, which is totally fine. As I said, I will be at the retreat for at least part of the time later in the week. I hope some of this was helpful. I was not hoping to put a wrench into anyone's goals or derail any of the work that all of you have done, the hard work that all of you have done so far to write the goals of the strategic plan. I really love the fact that we're trying to move towards a needs assessment informing strategic plan type model. We just have to start the needs assessment now, like way earlier. Oh, Cynthia, you raised your hand. I don't see you, but you can unmute yourself. Go ahead.
Hi.
Hi.
Hi. I really enjoyed that, and it was great to see more representation from the Asian American community in the more recent needs assessment. And I was curious, and you may have mentioned, but I was curious if like language was incorporated as like a barrier for service access. But I wanted to just also share that, what you were sharing is so much of what I'm seeing through the Ramirez June Initiative with outreach with immigrant service providers, just about the barriers for immigrant communities to access, evaluations, to even get into the service systems. And then once they're in, to get services. And if there's a language barrier, it can make it so much more difficult.
Oh my gosh. Totally. And we did hear that, especially for our participants in focus groups, that English wasn't their primary language. not only is the system itself super confusing, you add the language barrier to that and not speaking English as a first language, and it was almost, insurmountable for some parents. Luckily, a lot of the parents that we talked to sort of had that trusted messenger or that leader that they could engage with that really helped them through that process. And I'm sure that is how they got connected with the focus groups, as well as how they got connected to the services. But my guess is if we could, get our finger on the pulse of sort of what's happening in the larger community of new Americans and immigrants, we would hear much more just that frustration of navigating a system that's already complicated and then trying to do it not speaking English as a first language. Well, I forgot what I was saying before, but I will be there. So anyway, if anyone has any questions or wants me to put together any data or answer any questions, please feel free to reach out on email. As I said, I'll be at the retreat for a while and happy to sit with groups and, try to bring as much data as I can to that conversation. And I'm just excited about the fact that we really are trying to link the needs assessment with the strategic plan. And next year we'll just start the needs assessment before we even know that we have a grant, and so we'll get it all done before the strategic planning starts. All right, thank you all so much for coming. I really appreciate your time. Have a great rest of your day. Enjoy the sunshine.